Legacy Community Health Services is requesting a grant to fund 1 month of our program, meeting the needs of the recently HIV diagnosed. This program will provide HIV/AIDS medications immediately to those who are diagnosed at our clinics in the Houston, Beaumont, and Baytown area, regardless of the patient's ability to pay. Studies have proven that the sooner an HIV-positive individual gains access to medication, the more positively that individual will respond to treatment. In addition, we will provide application assistance to those patients who are interested in entering the Texas AIDS Drug Assistance Program. Our success will be measured by our ability to reduce the time it takes to qualify for that program by 10% or more. The program will last 1 year and will be funded by 12 grants or donations of $50,000 each. We are hoping that your foundation will be among those who will provide that support. Legacy Community Health Services has been serving the Houston area since 1978, rooted in the AIDS endemic, but growing to serve over 45,000 people annually with dental, ocular, behavioral, gynecological, and medical services. The bulk of our expenses still go to HIV and AIDS services, empowering our clients to lead a better life. We are committed to providing quality health care to a diverse community, including those persons who have traditionally faced problems with such access. The specific program for which we are seeking your assistance is to provide early pharmaceutical intervention for the recently HIV diagnosed. Research has shown that early pharmaceutical intervention reduces hospitalizations, delays or eliminates the chance that an individual will become completely disabled, reduces the likelihood that those who interact with the HIV positive will become infected, and can often reduce the side effects of prescription medications. Early intervention has also been found to disproportionately help minorities. According to Richard Trudeau, non-white persons in the United States tend to learn of their HIV infection later in the course of disease than do white persons. In other words, non-white persons often find that the disease has progressed farther than whites and are in more immediate need for medicines. HIV often produces uncomfortable symptoms, which may be alleviated by medications, thus improving the quality of life for the patient. And finally, because early pharmaceutical intervention reduces the likelihood of a hospitalization or disability, it saves money for the patient and society. During 2013, Legacy Community Health Services provided $3,364,925 worth of care to the HIV/AIDS community of Houston, Baytown, and Beaumont. The U.S. Census reports that over 15% of families in this area live at or below the poverty line, and 25% of families were uninsured in 2013. The Houston area was reported to be the 8th most HIV/AIDS impacted local jurisdiction in the country, and ranks 3rd in the National AIDS Drug Assistance Program. Legacy Community Health Services has the goal of empowering clients to lead a better life by providing premium, compassionate primary health care services. These services include dental, vision, counseling, and wellness services. Its origins rose from caring for those exposed to HIV, and that responsibility continues to be a priority. Our program objectives are simple. Each meeting the needs of the recently HIV diagnosed grant will pay for 1 month of early intervention medicines for the recently diagnosed. Additionally, we will strive to reduce the duration of time between HIV diagnosis and enrollment into the Texas AIDS Drug Assistance Program by 10% or more, thus reducing the time which clients will need to be supported by this program. Presently, our program tests and counsels individuals interested in determining their HIV status. If a patient tests positive, additional counseling is provided, and the client immediately starts an appropriate medical course of action. This is done regardless of the ability to pay. The cost to Legacy Community Health Services has exceeded income by $600,000, annually for these services. Additionally, the measured objective of this program will be to reduce the duration of time between diagnosis and enrollment into the Texas AIDS Drug Assistance Program by 10% or more. The financial objective of this proposed $50,000 grant is to cover the monthly shortfall of expenses for the recently HIV diagnosed. During 2014, an average AIDS Drug Assistance Program, ADAP, qualification time will be determined. During 2015, a quarterly evaluation of the ADAP qualification time will be performed to ensure a reduction of 10% or more. Our project timeline is as follows. In June through December, Legacy will apply for 12 grants of $50,000, each covering the cost of medicines for 1 month for the recently HIV diagnosed client. In September and November of 2014, and January and March of 2015, if necessary, we will evaluate the success of the grant requests. If we find that all the months of 2015 are not supported, we will seek donations to cover any grants that we have not received in December through May. Training for volunteers will occur in August through November of 2014. Training for those performing patient intake will occur in December 2014 and January 2015. If necessary, we will do an additional training session in July 2015. Training for those assisting with AIDS Drug Assistance Program, or ADAP applications, will be in December 2014 and January 2015. During 2014, statistics will be collected on the average qualification time for ADAP coverage. The qualification time will be reevaluated in March, June, September, and December of 2015. The 12 grants or donations will fund each of the 12 months of 2015. An evaluation of the overall program will occur in the first 2 months of 2016 for a report back to the grantors. There are 10 locations in the Houston, Baytown, and Beaumont region in which the program will be active. The $600,000 in grant income will closely match the expected shortfall between the 2015 expenses and income. Meeting the needs of the recently HIV diagnosed will be a 1-year program. It is expected that the Affordable Care Act of 2010 will ensure that most individuals will be fully insured by 2016. The Houston, Baytown, and Beaumont area have been particularly hard hit by the AIDS endemic since the early 1970s. Studies have shown that with early pharmaceutical intervention, an HIV diagnosis is no longer a death sentence for the patient. HIV/AIDS has become a manageable disease for most of those affected. Legacy Community Services has been at the forefront of care for area residents. It is our goal to continue that commitment to a community which has generally been underserved by other programs. With the assistance from your foundation and others, we hope to provide the early intervention which has been shown to be beneficial to those who have been affected by this disease.